Okay, good afternoon to everyone. So, we were discussing about muscular dystrophies, muscles when they are unable to form or grow as normal proteins are needed. If they are deficient, at that time there are various diseases, and namely they are known as muscular dystrophies. So, today we are going to see furthermore about which are the types of dystrophies, which are the common types, and what are the causes, how much is the prevalence, and signs and symptoms also. So first we are going to discuss about the classification. Yes. So most important, sex-linked or sex chromosome-linked diseases, DMD, BMD, and ADMD, autosomal, limb-girdle, and facioscapulohumeral disorders, or we can say dystrophies. Autosomal is FSHD, distal muscular dystrophy, ocular, and oculopharyngeal. નામ પરથી આપણે કાલે જ વાત થઈ કે according to the names itself you can see which disease is affecting which part, mainly which parts of the body. So to represent, these are the four most common type of muscular dystrophies, out of which first you can see Duchenne's and Baker's, affecting thoracic region and shoulders and the arms, along with lower limbs. To an extent they spare the dorsiflexors and the foot musculature, but they do affect the thigh muscles. Limb girdle, as the name suggests, shoulder and a hip passe girdles. Yes, shoulder girdle and hip girdle, they will be the first ones to get affected. Always remember, these are progressive diseases. It will start at one point with specific muscles, but later stages માં ઘણા બધા muscles involved થશે. તો starting માં તમે patient ને જોતા હોય તો sign and symptoms will be considerably different, and otherwise there will be and symptom other regions of the body also affecting. Muscular dystrophies, the third is facioscapulohumeral. Name suggests face muscles, scapular region, and the humeral, that is the arms and the shoulders, that will be affected. Emery diffuse, you can see shoulder region will be the most affected, as well as dorsiflexors, they will be affected more. That is Emery diffuse, sex linked related most of the diseases, disorders. Again, if I have to represent, we can say Duchenne's and Baker type. You can see the regions affected: neck muscles, thoracic region muscle, shoulders, and the arms, along with hip region, and to some portion everters will be more affected. In Emery diffuse, we can see shoulder, pectoral muscles also affected. Along with that, you can also see the everters, again the foot musculature also being affected. Yeah. Okay. Going forward, in the limb girdle type, so shoulder and the related musculature, hip and the related musculatures are affected. Distally, you see it is all clear. Yes, in the hand, in the lower limbs, it is all clear. Facioscapulohumeral, face, scapular muscles at the posterior region and anteriorly, you can see the humeral muscles, shoulder muscles, and nearby structure will be affected. Oculopharyngeal type, here directly ocular muscles will be affected. Along with that, face, neck, and girdle muscles will also be affected. That is oculopharyngeal type of muscular dystrophies. Now coming to the first major type, that is Duchenne's muscular dystrophy. Yes, so William Benjamin Emmett Duchenne was the French neurologist who discovered or who named the disease, and today we are following the same nomenclature. So what is the change, what is the etiology, શું કામ થાય છે? So it is a single gene defect. એક gene ના લીધે આ defect થાય છે, which is the gene XP21.2 region. Absent dystrophin protein, જે રીતે આપણે વાત કરી, absent હશે, કેલ્શિયમનું મેટાબોલિઝમ ચેન્જ થશે, excessive amount of calcium અંદર આવશે, સેલ મેમ્બ્રેન ડેમેજ કરશે અને સેલ નેક્રોસિસ થઈ જશે, સેલ ડેથ થઈ જશે. Cell death થઈ ગયું, એનું ફંક્શન નહીં કરે, and the structure of the muscle will not be complete. This is the same thing, just talking about microbiologically. So whole muscle, from which is a bundle of muscle fiber, along with there is a single muscle membrane. This single muscle membrane will have proteins along the whole structure. These proteins are mainly developed by the dystrophin. Dystrophin is absent in the DMD. Because of this, there will be change leading to out of form transcription, dysfunction and unstable dystrophin. Dystrophin unstable હશે, એનું function નહીં કરી सकते, more and more amount of calcium going in, causing necrosis of the cell. That is the main pathology behind DMD. So it is X-linked recessive. X-linked recessive. Yes. So you can see if a mother is affected, if a female is affected, always there will be a carrier. કોઈ દિવસ female માં DMD નહીં જોવા મળે. Why? Because it is an X-linked, always recessive. Yes. So because females always have a second pair of X chromosome. Yes, you remember from the biology, XX is female, XY is male. तो XX એમાંથી એક હશે તો it will be recessive type, એક dominant હશે તો એનું characteristic recessive બાર ના લાવી શકે. That is why a female will always be a carrier. Yes, and if it is a boy તો એની પાસે એક જ X છે, એ recessive હશે તો express થશે એટલે patient ને DMD થશે. Yes, so you can see unaffected father who does not have any recessive gene. If a mother is just a carrier, એમના નથી, and that is when there are chances that 25% chances that the son will be affected. Female, you see the female unaffected at all, 50% chances, another 50% chances carrier, એટલે એમાં તો express થવાનું જ નથી. Yes, so it is most common type of muscular dystrophy. Second, it is seen in males. 1:3,500 live birth male. Yes, so 3,500 male births થાય એમાં એક patient ને DMD હશે જ. 1/3 of new mutation and 65% family history. Yes, so there are 65% chances the family would have occurred. Family માં કોકને થયું હશે, and then only the patient will have the will give you the history part, that is family history. Either from the maternal side or paternal side, બંનેમાંથી આવી શકે. Mother is also a carrier at least. This is the clinical manifestation. Most important to remember. Typically, you see such patients, આવા patients તમને જોવા મળશે in clinical postings. Yes, typical આવું posture હશે. The first thing that you observe is shoulder and arms are held back awkwardly when walking. Yes, this is to maintain the center of gravity. Yes, center of gravity વચ્ચે maintain કરવા માટે extension, hyper extension થશે. And you see the belly, you see the lordosis, it will be increased. So this is sway back posture. Belly sticks out due to weak belly muscles. So abdominal muscles are very weak. Because of that, the belly will stick out. Weak butt muscles. So again, hip extensors are weak. એના લીધે પણ lower cross syndrome જે આપણે કહીએ એ પણ હશે patient ને. Knees may bend back to take the weight. This is all in compensation of the spine. Yes, spine જે alter થઈ ગયું, lordosis increase થઈ ગયું, sway back posture છે, એને maintain કરવા માટે knees ને થોડા anteriorly shift થશે. Compensation, opposition. Thick lower leg muscles, and muscles is mostly fat and not strong. Tight heel cord, that is child may walk toes. He tries to walk on the toes as much as possible. Belly sticks out as we talk. Thin, weak thighs, especially front part is very weak. You can see muscle wasting, atrophy. Poor balance, falls often, awkwardly clumsy if walking. જ્યારે પણ ચાલતા હશે બહુ જ clumsy, એટલે જે smooth movement થવી જોઈએ, coordinated movement થવી જોઈએ એવું નહીં થાય, and the patient will walk in a clumsy way, which is unnatural and unpleasing way. Weak muscle in front of the leg cause foot drop and tip-toe contractures. Yes, you may be asking, okay, toes ઉપર શું કામ ચાલવાનું? Yes, but because of prolonged contractures, patient na toes એ રીતે થઈ ગયા હોય, the foot remains in the plantar flexion. So the patient has no option but to walk on the toes. Yes, that is why the patient walks on the toes. And also, one important thing, thick lower leg muscles. આપણે વાત થઈ હમણાં સુધી કે patient ને atrophy થઈ જાય, that is reduction થઈ જાય, reduction in mass. Yes, atrophy. આપણે examples પણ જોયા, if you recollect, biceps muscle. Yes, if we saw, yes, so you see the muscle belly, it has decreased so much. But at times lower limb specifically calf muscle ma, to be very precise, yes, calf muscle ma gastrocnemius soleus ma તમને જોવા મળશે what is termed as hypertrophy. Why will there be hypertrophy? Hypertrophy happens because fat gets deposited in place of muscle cells. મસલ જ્યાં હોવા જોઈએ, મસલ સેલ, મસલ ટિશ્યુ જ્યાં હોવું જોઈએ એની જગ્યાએ ત્યાં ફેટ ડિપોઝિટ થવા માંડશે. મસલ નું ફંક્શન શું હોય? સ્ટ્રેન્થ જનરેટ કરવાનું, પાવર જનરેટ કરવાનું. ફેટ ત્યાં એની જગ્યાએ બેસી જાય તો એ મસલ વીક થઈ જશે. યસ, that is why it is also termed as something known as pseudo hypertrophy. Pseudo means false, hypertrophy something that you observe. તમે જોશો ને તો તમને એવું જ લાગે આમના કાફ મસલ બહુ સારા છે, એથ્લીટ જેવા કાફ મસલ લાગે, એટલા સ્ટ્રોંગ, એટલા બલ્કી, but there is fat. That is why it is pseudo hypertrophy. It is a diagnostic sign of DMD and DMD. Remember these words, diagnostic sign of DMD and DMD. So tight heel cord, contractures and thicker lower leg muscles. The muscle is mostly fat and not strong. Yes, muscle ની જગ્યાએ fat આવી ગયું હોય, fat એકને એક જગ્યાએ રહેશે and it will show hypertrophy. That is pseudo hypertrophy. Yes, so onset age 3 to 6 years. Yes, 3 to 6 years માં patient ને દેખાઈ આવે. Parents start to complain. Parents complain કરશે, child નહીં complain કરેगा. He will not say I am not able to walk. The parents will observe at 3 years also is not walking. So that will be the first complaint. Then there is progressive weakness. Starting માં ચાલી પણ શકે, પછી વારે ઘડીએ પડે. And there are some incidences when serious injuries might happen. So the weakness is progressive. Then we talked about pseudo hypertrophy of calf muscles. Yes, muscle ની જગ્યાએ fat deposit થશે. Because of this fat it looks like the muscle is hypertrophied, but actually it is weak muscle. Spinal deformities, we already discussed about spine deformities. Increased amount of lordosis is the first and most important diagnostic sign. Cardiopulmonary involvement, in the later stages there is cardiopulmonary involvement. Heart and even the lungs get weak. The muscle, yes, heart is also a muscle. Smooth muscles are all types of muscles, and also skeletal muscles, even diaphragm, even intercostal muscles, these are all muscles. Muscles માં dystrophy નહીં હોય, function alter થશે slowly and steadily. Progressive disease છે. The heart stops to function. Pulmonary, that is muscles responsible for respiration, also stop to work, and eventually the patient will die. Mild to moderate MR, mentally retarded. Yes, so even though it is not fixed, but there are chances, around 50% chances, if the patient already has DMD, there are chances they will also have decreased IQ. That is mild to moderate MR. Yes, mentally retarded. So the IQ is decreased. You can just see that thing. Natural history. So you can see from the graph here shown, a bar graph, from 0 to 7 or up to 10 years, they can have ambulatory phase. They can walk independently. They can live a normal life up to 10 years of age. Yes. Here in 7 to 10 years there is decreased ambulation, but with the help of walking aids, say for example walker, cane, sticks or crutches, anything, the patient can still walk. After 10 years, 10 to 20 years, or we can say up to 10 to 18 years, there is wheelchair phase. That is, the patient has to be bound to a wheelchair. ગમે ત્યાં જવું હોય, wheelchair through જવું પડે. Yes, so that is one of a phase in the life of a DMD patient. And from 10 to 18, scoliosis also develops. 80% respiratory diseases also happen, and later on, because of these diseases, because of the immunity is compromised, muscles are weak, in the 18 to 20 years there are chances the patient will not survive longer. Yes, and will die eventually. So that is also the terminal stage. Progress slowly and continuously. Muscle weakness, lower limb is more affected than upper extremities. Lower limb also is more affected compared to upper extremities. Unable to ambulate, 10 years, 7 to 12 years is average. Even when they can maximally ambulate, પછી એમને support in form of ambulatory device or wheelchair usage. Death from pulmonary or cardiac failure, second or third decade of life. Maximum what you can expect is 30 years or 30 to 35 years, after which the patient cannot survive. That is a thing you have to accept anyhow. So શું problems હશે, patient શું problem or patients. So up to say for example from second or third year of life up to 10 or 12 years, patient એક જ complain કરશે walking difficulties. Later on, wheelchair માં skeletal deformities form થઈ જશે. Wheelchair, when a patient is bound on a wheelchair or on a bed for prolonged period of time, એક ને એક position માં તમારા lower limbs, upper limbs, spine, બોડી આખું એક પોઝિશનમાં રહેશે. બીકોઝ ઓફ ધેટ there are going to be various deformities. કેટલી બધી deformities થઈ શકે. Yes, knee contractures, flexor contractures at the wrist joint, elbow joint, shoulder remains in abduction, whatever. So there are many regions of the body, because of prolonged position they will remain as such. Yes, and contractures develop, deformities develop. Second, very limited use of arms. Yes, eventually પહેલા તો lower limb માં problem હશે, પછી upper limb માં પણ problem start થશે. That is why we have talked walking problem initially, and now we are talking about the limited use of arm. So arms, specifically girdles, જે એટલી weak થઈ જશે that you can directly feel the bone. તમને bone જ feel થાય, muscle નો bulk feel જ ના થાય. Yes, so at that time when there is no muscle, when there is no muscle power or strength, of course patient નહીં જ use કરી શકે upper limbs. Then ventilation at night. So specifically when the patient is lying supine, at that time they might require ventilatory support also at night. Yes, from the day they can do some activity, they can sustain, but at night they might need the support. And at the end, ventilation is 24 hours also. At the last decade, from 20 to 23 years up to 30 or 35 years max, the patient will have death. Yes, because of the complications. So pseudo hypertrophy, you see here. Yes, on the calf muscle, see how much this, you can see the girth. Yes, you see the back muscles, scapular muscle, you see the gluteal muscles, you see the abdominal muscles, you see the biceps, you see the thigh પણ જુઓ, and compare it to the calf muscle. Calf muscle કેટલા bulky લાગે છે, like he is an athlete. Yes, but this is pseudo hypertrophy. That means the patient has had fat deposits instead of the muscle tissue in the calf muscle. Yes, calf is the most common muscle that gets pseudo hypertrophy. Yes, other muscles also get it, but calf is the most common region. Why? It is predetermined, prefixed. You can also see the tiptoe gait. Yes, see how the patient is standing. Yes, directly on the tips of the toe. Forward tilt of the pelvis, you see the pelvis, it is anteriorly tilted, and compensatory lordosis. See the lordosis, level of lordosis so much increased than in normal individuals. This is sway back posture. Abdominal muscles are weak, and alide lordosis na lidhe the patient has secondary changes, and because of the deformities in the lower extremity in the foot, remains in plantar flexion, toes directly weight bearing the whole body weight. This is important sign. You see, જ્યારે પણ patient standing માં હશે તો કેટલું excessive lordosis છે. Yes, this lordosis is because it is because of the pelvis tilting. Pelvis tilted છે, એના compensation માં lordosis છે. Now when the patient sits, this tilt of the pelvis is gone. So શું થશે? Lordosis આખું decrease ગયું, zero, normal થઈ ગયું patient. Yes, so this is one of the diagnostic signs of DMD, that there is, because of the anterior pelvic tilt, the patient is having increased amount of lordosis in standing. Also, main diagnostic sign of DMD and BMD is Gower's sign. Gowers, Gower's sign. Yes, you ask the patient to stand from sitting position on the floor. You ask the patient to stand from the sitting position on the floor. બાળકને જમીન ઉપર બેસાડી દેવાનું અને કહેવાનું, now you have to stand up, ઊભા થાઓ. Yes, without taking any support, no wall, nothing nearby, વચ્ચોવચ્ચ બેસાડી દેવાનું રૂમમાં અને કહેવાનું કે ઊભા થાઓ. Then what the patient does, they will use their own body. એ પોતાના બોડીને યુઝ કરીને ઊભા થશે. કઈ રીતે? પહેલા આ રીતે સપોર્ટ લેશે ગ્રાઉન્ડનો, then એક હાથ ની ઉપર, બીજો હાથ ની ઉપર, અને પછી ધીમે ધીમે ક્લાઇમ્બ કરશે પોતાની ઉપર. They will try to climb on their own body, upper limb થી ધીમે ધીમે હાથ ની પાસે, thigh પાસે, pelvis પાસે, અને પછી સીધા થશે. Yes, so this is diagnostic sign of DMD and BMD, known as Gower's sign. Make the patient sit in the center of the room and ask him to stand from that position. The patient will always take support from the floor, then of his own body to get up, which shows what? આનાથી prove શું થશે કે patient ને lower, or we can say back extensor weakness છે, and the patient is not able to extend or has decreased strength of lower extremities and back muscles together. Yes, so this is what you prove from the Gower sign. Gower sign positive hoy, 100% the patient is having DMD. Yes, if I ask you to stand, what will you do? You'll use your upper limbs, of course, for the first. This step is common, but you will not do this thing. હાથ ની પાસે નહીં રાખો તમે. Why? Because you don't require that. Your hip extensors, knee extensors, as well as the back extensor are strong enough to make you stand. But our patients man na hoy. Yes, and because they use their own support. Diagnosis. How do you confirm the diagnosis? First, gait. Yes, આપણે જે વાત થઈ, clumsy gait હોય, tiptoe gait હશે. સેકન્ડ, એબ્સન્ટ ડીપ ટેન્ડન રિફ્લેક્સિસ. પ્રોબ્લેમ ક્યાં છે? મસલ્સમાં. રિફ્લેક્સ કોઈ પણ લેતા હોય તો મસલ્સ આર ધ ઇફરન્ટ ઇફરન્ટ ઓર્ગન્સ. ઇફરન્ટ ઓર્ગન્સ વીક હોય કે અલ્ટર્ડ હોય તો ડીપ ટેન્ડન રિફ્લેક્સિસ ઓછા, ડિમિનિશ, હાઇપોરિફ્લેક્સિયા ઓર એરિફ્લેક્સિયા થઈ જશે. Ober test and Thomas test. We are going to see, you have already known this test in musculophysiotherapy. Yes, can someone tell me what is Ober test? Ober test એટલે શું? Why do you do Ober test? Ober test એની માટે કરાય. What do you check? It is mainly to check IT band tightness. Yes, so IT band, how do you do it? You go for the patient will be in sideline position, પછી તમે patient ના foot ને extend કરશો or thigh hip region ને extend કરશો, and you try to bring it in the adduction. Yes, when you try to bring it in the adduction, it will cause pain. If it is painful, then yes, the Thomas test is, sorry, Ober test is positive. Yes, so that is about the first Ober test. What is Thomas test? That is for Thomas test એની માટે હોય. Thomas test, yes. શેની માટે હોય Thomas test? It is also related to stretching. That is why both these terms are related to stretching muscles. So Thomas test, what is it used for? To check which muscle? Okay. It is used to check the hip flexors. Yes, so hip flexors are checked through Thomas test. The patient will be on the edge of the table, one leg is bent, knee to chest, and other you try to move as much as possible into extension. When the patient feels, yes, there is stretch pain, that means the Thomas test is positive, that suggests that the muscle is tight. Third important sign is Meyerson sign, that is child slips through truncal grass. જ્યારે પણ typically Indian females, where do they keep their child? On the side of the trunk. That is, જ્યારે પણ એક હાથમાં anything they would carry, and on the one side they will keep their child. જો એમાંથી child slip થઈ જાય, એટલે કે muscles એટલા weak છે childના કે they are not able to grasp the mother also. Yes, that is an important sign, that is Meyerson sign. Macroglosia, myocardial deterioration, IQ, as we talked about, will always be less, mild to moderate MR. Increased CPK, that is more than 200. Myopathic change in EMG, electromyography. Specifically, muscle degeneration, we can diagnose through it. Muscle degenerate થઈ ગયું હશે. Why degenerate? Muscle fibers જ નહીં. Immunoblotting, that is absent dystrophin DNA mutation analysis. So you can go till DNA analysis. It is a very costly thing, but yet can be done for individuals, and they can find what is the main point. This is Auber test. You can see keeping the patient in sideline, hip ને extend કરીને adduct કરવાનું. એમાં નીચે જો pain થાય patient ને, that means IT band or TFL is very tight and needs release. And Thomas test you can perform on the edge of the table, one leg hip to knee કરી નાખવાનું, અને second you try to extend as much as possible, તો hip flexor tightness ખબર પડશે. There is not just one way to treat muscular dystrophy. Treatment includes physical therapy, assistive devices, medications, and even surgeries. Yes, all of these are possible. And later on, when we are going to discuss in detail about all these things, we are going to see that specifically physical therapy will help maintain, assistive devices will improve the quality of life or quality of mobilization, movement. Medication and surgery have a very limited role. Yes, કોઈ એવી medicine નથી જે આને reverse કરી શકે. It is just symptomatic relief that we are going to provide, because we already know the fate of that individual, fate of the person. So survival percent of male diagnosed with DMD at different age ranges. 5 to 9 years also death થઈ શકે. Yes, so slowly and steadily you see the individuals, number of individuals, they keep on decreasing, and when an individual reaches 25 or more, max 30, 35, at that time there is zero survival rate. કોઈ પણ DMD નું patient 30, 35 થી વધારે ના જીવી શકે. Yes, this is something we have to accept. And the last lecture we talked about sympathy and empathy. Here we need to have empathy, not sympathy towards the patient and their parents. Yes, okay. So we'll keep it till here. Yes, in the next lecture we are going to discuss in a bit detail about Baker's muscular dystrophy. બધા symptoms sign બધા same. Just onset late હશે અને symptoms થોડાક mild હશે compared to DMD. And these people or the patients with DMD can live for a longer duration of time. That is the only difference we'll be seeing. Also, other types except DMD and BMD, we'll see just an overview. We do not need to go in that much detail for these muscular dystrophies. Yes. So એમાં શું main symptoms છે, main signs છે, and later on a general આપણે treatment plan જોશું for all these conditions. Yes. Okay. Any doubts you have so far? Please let me know. Write in the chat with yes or no.